Ashley Jackson was 8 months pregnant, and her body had been showing signs of exhaustion for weeks. The weight of her growing belly, the discomfort in her back, and the restless nights had taken a toll on her. But today was different. Today she felt sharp, stabbing pains in her abdomen that she couldn't ignore. Her husband, Daniel, had been urging her to go to the hospital, but she had been reluctant. It wasn't the first time she'd felt something was off, but this time, the pain was unbearable. "I'm going," she told Daniel, the decision firm in her voice. "I'll call the ambulance." In the emergency room, Ashley sat uncomfortably in a plastic chair, clutching her belly. The waiting room was filled with people, some visibly sicker than others. She had always been healthy, always made sure to eat right, exercise, and take care of herself. But now, she felt small, alone in her pain. A nurse approached her after a long wait. Her name tag read Claire Wilson. "You're the pregnant woman, right?" Claire asked with a curt tone. Ashley nodded, her face strained with discomfort. "Yes." "I think I'm in labor, or something's wrong." Claire glanced at the patient chart in her hands, then at Ashley's swollen belly. "Well, it's probably just Braxton Hicks contractions. You're fine. We're busy, so take a seat and wait for your name to be called. It'll be a while." Ashley stared at her, her heart racing. She had read about Braxton Hicks contractions, but this wasn't the same. This wasn't just discomfort. It was pain. Real pain. "I think you need to take me seriously," Ashley said, her voice shaking slightly, the pain building in waves. Claire dismissed her with a wave of her hand. "It's common in the 3rd trimester. You're probably just overreacting. You're fine." Ashley felt her frustration mount as the nurse turned her back and walked away. She was afraid. Her instincts screamed at her that something was wrong. She had read about the dangers of ignoring symptoms during pregnancy, especially as a black woman. There was a fear that if she was seen as an overreacting black woman, her concerns would be dismissed entirely. She clenched her jaw and waited. Time passed. Hours had passed, and Ashley's pain had only intensified. She had tried to hold it together, hoping that it was just the early stages of labor. But with each passing minute, the pain became more unbearable, and her anxiety grew. She checked her phone. It had been almost 3 hours since Claire had first dismissed her. Where was everyone? Why hadn't anyone come to check on her? Ashley's head was spinning, and she felt her body start to tremble. Sweat gathered on her forehead as her hand instinctively went to her belly. She knew something was wrong. This wasn't just the typical pregnancy discomfort she'd read about in her pregnancy books or heard about from other mothers. This was real, pressing pain, the kind that made her vision blur and her breath shallow. With trembling hands, she reached for the button to call for a nurse. But before she could press it, a rush of dizziness swept over her. She tried to steady herself, but her vision began to fade. Panic surged through her as she felt herself slipping into unconsciousness. The room spun. Her body went cold. When Ashley woke, she was no longer sitting in the waiting room. The sterile, harsh lighting of the emergency room had been replaced by the softer, dimmed lights of a hospital room. She could hear the beeping of machines around her, and her heart skipped a beat. The first thing she felt was the emptiness in her stomach. Her baby. Was the baby okay? Her hand shot to her belly, but the pain was still there, an echo of the earlier discomfort. The door to the room opened, and a woman entered, her features kind but with a stern edge, as if used to handling emergencies. She was dressed in scrubs, and her badge read, "Dr. Caitlin Marsh." "You're awake," the doctor said, her voice gentle but firm. "How are you feeling, Ashley?" Ashley blinked, trying to process everything. I'm dizzy. What happened? Where's my baby?" Marsh pulled a chair next to the bed and sat down. "You were suffering from severe preeclampsia, and it led to a number of complications. We had to do an emergency C-section to save both you and the baby. Thankfully, both of you are stable now, but it was touch and go for a moment." Ashley's heart hammered in her chest. Preeclampsia? A C-section? Why hadn't anyone told her sooner? "The nurses, they told me it was nothing," she whispered. "They said I was overreacting." Dr. Marsh's eyes softened. "I'm sorry. I can't speak to what happened before, but I can assure you, Ashley, that the pain you were feeling was real. And if you had waited much longer, we might not have been able to save either of you." Ashley felt tears prick at her eyes. She had been right. She had known something was wrong, but no one had listened. Why hadn't anyone taken her seriously? "Doctor." Marsh placed a hand on Ashley's arm. "You're going to be okay, but we need to talk about what happened here." I want to make sure you understand what's going on. And I also want to apologize for the delays. You shouldn't have had to go through that. Ashley's mind was spinning. She wanted to scream, to shout, to demand answers. But she also felt an overwhelming sense of exhaustion wash over her. "Where's my husband?" Ashley whispered. "Where's Daniel?" Dr. Marsh gave her a reassuring smile. "He's on his way. He's been very worried." Daniel arrived an hour later, looking frantic. His eyes searched the room before landing on Ashley. He rushed to her side, holding her hand tightly, his face a mixture of relief and concern. "You're okay?" he asked, his voice tight with emotion. Ashley nodded weakly, her throat constricting as she gazed at her husband. She wanted to cry, to let out all the emotions she had bottled up during the past few hours. But she was too tired. She was emotionally drained, physically spent. And yet, despite everything, there was a burning fury inside her that wouldn't go away. The days following the emergency C-section were a blur. Ashley's body was healing, but her mind raced with the injustice she had experienced. She couldn't shake the feeling that if she hadn't been black, if she hadn't been seen as just another overdramatic patient, maybe things would have been different. She thought about the nurse, Claire, who had dismissed her pain without a second thought. She thought about the hours she spent waiting, trying to convince herself that maybe, just maybe, the hospital staff had her best interests at heart. But she couldn't ignore the glaring truth. Her race had likely played a role in the way she was treated. Ashley wasn't the type to stay silent, especially when something so deeply personal was at stake. She had always been a journalist, always looking for the truth, even when it was uncomfortable. And this situation was uncomfortable. No, it was downright infuriating. She knew that if she didn't speak up now, it would only continue, and more women, more black women, would face the same fate she had. She sat up in her hospital bed, a fresh resolve settling over her. She would write about this. She would make sure her voice was heard. No one should have to go through what she had endured. She would tell her story, and maybe, just maybe, she could change the way hospitals treated black women. Ashley reached for her phone, her fingers shaking as she typed the first words of her article. "The danger of being disbelieved, a black woman's experience in the ER." She hit send. It was time to make a stand. Ashley stared at her phone for a few moments, the weight of what she had just done slowly sinking in. She had written and sent an article about her experience to a small local news outlet. But now the hard part began. She wasn't sure what she expected. Maybe a response within a day, or an acknowledgement from a journalist who would take her story seriously. But what happened next was beyond anything she could have imagined. It started slowly. Within hours, people began to share her post on social media, commenting on it, and reacting with anger, support, and disbelief. The response was overwhelming. By the following morning, the small local outlet where she had submitted her article had reached out to her for an interview. Ashley felt a knot of anxiety twist in her stomach. She had always been good with words, but now, everything felt different. This wasn't just about writing a piece for her editor or drafting a short opinion piece. This was personal. It wasn't just her story. It was the story of so many other women who had been ignored, belittled, and treated as if their pain didn't matter. As she prepared for the interview, Daniel stayed by her side, offering support and encouragement. He had always been her rock, but now she could see the worry in his eyes. He had been there for her throughout the pregnancy, through the pain, and even the labor complications. But this was a whole new kind of challenge. "I know you're scared," Daniel said, his voice low, "but you're doing the right thing. People need to hear this. They need to understand what's happening." Ashley gave him a tight smile, the nerves still gnawing at her. She had never felt such pressure in her life. What if people didn't believe her? What if they dismissed her like the hospital staff had? But she couldn't ignore the fire inside her, the injustice of it all. How many women, how many black women, had faced the same kind of dismissal, their pain disregarded because of their race? How many others had been forced to fight for their lives in silence? The interview was set for the next afternoon, and when Ashley arrived at the small news office, she was greeted by a reporter named Mia Thompson. Mia was young, in her early 30s, with a warm, professional demeanor that immediately put Ashley at ease. She could tell Mia was genuinely interested in her story, and that gave her the courage to speak openly. They sat across from each other in a modest conference room, the hum of fluorescent lights overhead filling the silence. Ashley felt the weight of the moment. This was more than just an interview. It was her chance to make sure no one else would have to go through what she had. Mia started with the basics, asking Ashley to walk her through what had happened. As Ashley spoke, She could feel the emotions bubbling up inside her. She told Mia about the long wait, the pain that had been dismissed, the fear she had felt when no one seemed to take her seriously. She told her about Claire, the nurse who had casually brushed off her pain. She told her about Dr. Marsh, who had saved her and her baby, but acknowledged how close they had come to a devastating outcome. When she finished, Mia sat silently for a moment, her brow furrowed in thought. Finally, she spoke. "This is shocking," Mia said, her voice soft but heavy with the weight of the conversation. "I can't believe they just ignored you like that. Do you think your race had something to do with it?" Ashley took a deep breath, her mind racing. She had asked herself the same question 1,000 times since that day. She had read about the disparities in healthcare, about how Black women were more likely to face maternal health complications and receive substandard care, but she had never thought she would be one of those women. "I do think it played a role," Ashley said, her voice steady but firm. "I think if I had been white, if I had looked like the women who typically walk through those doors, maybe things would have been different. Maybe they wouldn't have dismissed me as overreacting. But because I'm Black, I felt invisible. I felt like I had to fight to be heard, and that shouldn't be the case. No one should have to fight for their pain to be taken seriously." Mia nodded, her expression thoughtful. "This is something that needs to be addressed. You know, I've seen studies that show Black women in particular are at a much higher risk of complications during pregnancy. But hearing your story, it just hits differently. It's not just statistics. It's real people, real lives." Ashley felt a flicker of hope. "That's why I'm speaking out. So that maybe one day it won't be so easy for doctors and nurses to overlook someone's pain. It's a matter of life and death, and it shouldn't take a crisis for people to listen." The interview was published later that week, and within hours it went viral. Ashley's article, her experience, resonated with so many people, especially women of color who had similar stories to share. The comments flooded in, some from strangers who had been in Ashley's shoes, others from people who were appalled that such blatant racism existed in healthcare. Ashley had expected a few comments here and there, but the response was explosive. She was contacted by national outlets, by bloggers, by individuals who wanted to know more about her story and how they could help bring awareness to the issue. But the most surprising part came when Ashley's story caught the attention of a major national magazine. A well-known journalist, Sarah Jenkins, reached out to her with an offer to do an exclusive interview. "Your story is one that needs to be told on a larger platform," Sarah told her over the phone. "We've seen the statistics, but your first-hand experience could spark real change." Ashley felt like she was at the beginning of something bigger than she had ever imagined. But despite the growing recognition and the flood of support, she couldn't shake the feeling of anger that had been burning inside her from the moment she had been ignored in the ER. She thought of the women who didn't have a platform, who weren't able to speak up. For every woman who had been listened to, there were countless others who had been left to suffer in silence. Ashley knew that her journey wasn't over. She had taken the first step in sharing her story, but now she was determined to keep pushing for change, and this was just the beginning. Ashley's phone buzzed constantly, both with messages and news alerts. Her article had touched a nerve. It was hard for her to keep up with the avalanche of responses, comments on her social media, emails from people all over the country sharing their own experiences, and even some well-known names reaching out to show their support. She had expected a bit of attention. After all, she was a journalist, and her story was compelling. But this level of attention, this national outpouring of support and outrage, was something she had never anticipated. Ashley sat at her kitchen table one afternoon, her coffee growing cold beside her as she sifted through the many messages she'd received. Among the flood of responses, she found one email that stood out to her. It was from Dr. Marsha Williams, a renowned obstetrician from a hospital in New York City. She had read Ashley's article and wanted to talk about how systemic racism was embedded in the healthcare system, particularly in obstetrics. "Curious," Ashley replied, arranging a phone call. As they spoke later that week, Dr. Williams expressed how deeply the article resonated with her. "You've put a spotlight on something many of us in the medical field have known for years, but haven't been able to talk about publicly," Dr. Williams said. "There's a real bias when it comes to Black women in obstetric care. We've known for decades that Black women are more likely to experience complications during pregnancy, more likely to be dismissed or ignored, and more likely to die in childbirth than our white counterparts. And yet, it's rarely addressed directly in policy." Ashley was stunned. She had known about these disparities, but hearing Dr. Williams speak so candidly about it made it feel more real, more urgent. "I'm not just talking about patients being ignored in hospitals," Dr. Williams continued. "There's something deeper, something institutional. From medical school to hospital protocols, racial biases exist at every level. It's not just about individual prejudice, it's systemic. The words hung in the air between them. For Ashley, it felt like a turning point. If someone as knowledgeable as Dr. Williams was speaking so openly about this, perhaps it was time to push even further. Maybe, just maybe, her story could be the catalyst for a real conversation about these issues. The journalist side of Ashley wanted to dig deeper, to explore the policies, to interview doctors, nurses, and patients alike. But the part of her that had felt so invisible in that hospital, the part of her that had nearly lost her life and the life of her child, wanted to speak out louder. She wanted to make sure that this conversation wasn't just a passing moment. She wanted it to spark action. Ashley began drafting a new article, one that would take a more comprehensive look at the healthcare system, racial disparities in maternal care, and personal stories from other Black women. She called up several sources, doctors, patients, social workers, and started conducting interviews. The more she spoke to women who had been through similar experiences, the clearer it became that what she had faced was not an isolated incident. This was happening across the country, and it was happening far too often. The responses she received ranged from heartbreaking to infuriating. One woman, Latasha, had experienced labor pains at 35 weeks pregnant, but was repeatedly sent home from the hospital because the doctors believed she was just exaggerating. Her baby was born with severe complications, and Latasha almost died during delivery. Another woman, Karen, told Ashley that her concerns during pregnancy were dismissed so frequently that by the time she was admitted for a scheduled C-section, she was almost too weak to move. The doctors had attributed her exhaustion to her weight, not considering that it was the result of untreated complications. Her C-section was successful, but she knew that if she had waited just a few more days, things might have been very different. "I don't want anyone to go through what I went through," Karen had told her, her voice breaking. "I just want people to listen, to take us seriously." Each story seemed to reinforce the same painful truth. Black women in America were being ignored, overlooked, and mistreated in medical settings, especially during pregnancy. Ashley included many of these stories in her next article. She didn't hold back, allowing the voices of the women she spoke with to shine through. She wrote about the dangers of racial bias in obstetrics, the impact it had on maternal mortality rates, and how it was time for healthcare systems to take a hard look at their policies and procedures. She knew the stakes were high, and this piece would push even harder for change. Meanwhile, the impact of Ashley's first article was growing. It wasn't just the readers or the people sending messages of support. The attention was reaching all corners of the healthcare industry, and soon, even the hospital where Ashley had been treated was feeling the heat. It began when a local news station picked up her story and ran a segment about the biases Black women faced in the healthcare system. The segment included an interview with Dr. Caitlin Marsh, who had performed Ashley's emergency C-section. She didn't mince words when it came to acknowledging the problems. "I've been practicing for over 20 years, and I've seen firsthand how women of color often receive subpar care," Dr. Marsh said. "There's no question in my mind that systemic racism exists in our hospitals. I think Ashley's experience is an unfortunate but not uncommon example of how Black women are treated in medical settings." That interview sent shockwaves through the community and put pressure on other hospitals to examine their own practices. Ashley, sitting in her living room, watched the segment with a feeling of pride mixed with disbelief. She had started this journey in the hospital room, unsure of how to speak out, and now, her voice was creating ripples that reached far beyond what she had ever imagined. The following week, Ashley was invited to speak at a town hall meeting about racial disparities in healthcare. The event was organized by several local advocacy groups, and it quickly became clear that there was a broader conversation taking place. Ashley spoke alongside doctors, social workers, and other women of color who had lived through similar experiences. "What happened to me was not just a personal failure," Ashley said to the crowd. "It's a systemic issue, and it's time we all start addressing it. If we don't speak up, we'll continue to let these women suffer in silence. If we don't fight for change, then who will?" The applause from the crowd was thunderous. The organizers approached her afterward, asking if she would consider writing more articles for their advocacy group, raising awareness about the issue. Ashley realized then that this was just the beginning. It wasn't just her story anymore. It was the story of every woman who had been silenced, ignored, or dismissed. And it was up to her to make sure that their voices would be heard too. The months following Ashley's initial article had been transformative. What had started as a deeply personal reflection on her experience in the hospital had turned into a movement. As her story spread across the country, it began to gain traction beyond the boundaries of social media and local news outlets. She was now being invited to speak at conferences, podcasts, and interviews, and her articles were regularly shared among policymakers, healthcare professionals, and those in the field of social justice. But even as her platform grew, Ashley knew the fight was far from over. The conversation surrounding racial disparities in healthcare was only beginning to shift, and she was determined to be a part of that change. One afternoon, Ashley was preparing for another interview. This time, it was with a major national news network. She was sitting in front of her vanity, adjusting her hair, trying to calm the butterflies in her stomach. After all, this wasn't just any news outlet. This was prime time with millions of viewers. She had been invited to talk about her journey, but more importantly, to delve deeper into what needed to change in America's healthcare system to protect Black women during pregnancy and childbirth. Her phone buzzed on the counter, interrupting her thoughts. It was a message from Dr. Caitlin Marsh. Ashley, I wanted to let you know that I'm taking action on a larger scale. I've gathered a team of doctors, nurses, and social workers who are passionate about addressing the racial bias in our healthcare system. We're launching a nationwide initiative aimed at reforming obstetric care. We'll be looking to partner with advocacy groups like yours. I wanted to personally tell you first. I hope you'll be on board. Ashley stared at the message in disbelief. This was exactly what she had been hoping for. A tangible, organized effort to combat the institutionalized racism in maternal care. Marsh had been one of the few to publicly acknowledge the problem, but now she was stepping up to do something about it. Ashley quickly typed a response. Absolutely. Count me in. I'll do whatever it takes. The interview went as expected. Ashley spoke with passion, sharing her personal experience and the stories of others who had reached out to her. She talked about the lack of trust many Black women felt in the medical community, and how that mistrust was compounded by systemic racism. She explained the impact of bias on the maternal mortality rate among Black women, and how the healthcare system had to change to address this. But even as she spoke, she couldn't help but feel frustrated. Her words, though impactful, were just that. Words. She had told her story, and she knew it had resonated. But how much longer could she talk about the problem without seeing real change? The interview ended with a promise of continued dialogue, but Ashley knew it wasn't enough. Dialogue wasn't action. She spent the rest of the evening going through her messages and responses, trying to take everything in. She had made a difference, but there was still so much to be done. That night, she met with Daniel. He was still her rock, the one person who had stood by her unflinchingly since the beginning. Over dinner, they talked about their future, about how they could continue to raise awareness and push for action. I think it's time to go bigger, Ashley said, her voice resolute. The media is paying attention, but I want to see change. We need to push for a nationwide policy shift. I'm not just writing articles anymore. I'm thinking about a movement, one that can force the hand of lawmakers, hospital boards, and even insurance companies. Daniel looked at her, his face serious. I'm all in. Whatever you need, I'm here. Let's do it. Over the next few weeks, Ashley partnered with Dr. Marsh's team, working tirelessly to lay the groundwork for a nationwide initiative. They called it The Mother's Voice. It was designed to be a comprehensive program that would address the issues Black women faced in the healthcare system, particularly during pregnancy. The initiative aimed to raise awareness, create educational materials for both medical professionals and patients, and most importantly, push for policy changes at the local, state, and federal levels. The team included doctors, activists, social workers, and Black women who had experienced what Ashley had gone through. Together, they formed a coalition of experts and advocates who were determined to create change. They organized petitions, mobilized protests, and began pushing for a federal review of maternal health care policies. Ashley became the face of the initiative, writing articles, speaking at public forums, and appearing on national news outlets. Every opportunity she had, she used to amplify the voices of Black women who had been marginalized by the healthcare system. She was no longer just a journalist. She was now a leader in the fight for racial equity in healthcare. One afternoon, after a long day of meetings, Ashley was sitting in her office when she received a call from Mia Thompson, the reporter who had interviewed her back when her story first broke. Ashley, I have some news, Mia said. The federal government has just announced that they'll be reviewing maternal health care policies, with a focus on racial disparities. It's a major step forward. Ashley sat up straighter, her heart racing. This was it. This was the breakthrough they had been working for. Mia continued. They're inviting the Mother's Voice Coalition to be part of the discussion. They want to hear from the women who have been affected. They want to hear from you. Ashley felt a wave of emotion flood over her. She had been part of something that was now being taken seriously at the highest levels of government. The idea that black women's pain and suffering was finally being acknowledged in such a profound way was both overwhelming and exhilarating. "I'm in," Ashley said, her voice firm. "We've been fighting for this for too long. We're not backing down now." The days leading up to the federal hearing were filled with meetings, phone calls, and countless hours of preparation. Ashley, Dr. Marsh, and the rest of the coalition worked tirelessly to ensure they were ready to speak with lawmakers. They prepared testimonies, gathered data, and arranged for several women who had experienced discriminatory treatment to speak. When the day of the hearing arrived, Ashley stood before a room full of government officials, healthcare leaders, and activists. The pressure was immense. This was the moment she had been working toward, the chance to present the truth, to demand justice. She took a deep breath and began. "My name is Ashley Jackson, and I'm here because I nearly lost my life and my child's life due to a healthcare system that refused to listen. I'm here because too many women, too many black women, are being ignored, dismissed, and discriminated against in hospitals across this country. We need real change, and we need it now." Her words echoed through the room, and for the first time, it felt like her voice was truly being heard. The months following the federal hearing were a whirlwind of activity, but Ashley could feel something beginning to shift. The hearing had been a pivotal moment, one where the voices of black women and the systemic issues in healthcare were finally given a platform. Yet, despite the promises made by lawmakers and the momentum behind the movement, Ashley knew that real change would require more than just words. It would take action, action that would require perseverance, collaboration, and above all, patience. At the beginning of the next year, after countless meetings with government officials, advocacy groups, and healthcare organizations, Ashley and Dr. Marsh were invited to present their proposal to a congressional subcommittee on healthcare reform. It wasn't just another hearing. This was the stage where policy decisions would be made, where they would push for tangible reforms to address the racial disparities in maternal health care that had long been ignored. Ashley sat at the conference table, feeling the weight of the moment. This time, it wasn't just her voice alone in the room. She was accompanied by a group of women from all walks of life, doctors, social workers, and mothers who had experienced the deep injustices of the system firsthand. They had come together to present a comprehensive plan, one that was designed to reshape the future of maternal care for black women across the country. Ashley's voice, once quiet and uncertain, now carried with the authority of someone who had seen the worst of the system and was determined to change it. "We're here today because for too long the pain of black women in America has been ignored," Ashley began, her voice unwavering. "We're here today because too many women, including myself, have faced discrimination, dismissal, and neglect in hospitals simply because of the color of our skin." She paused, letting the weight of her words settle in the room. The faces of the lawmakers before her were serious, some of them nodding in agreement. But Ashley knew that the real work was just beginning. "Since the release of my article," Ashley continued, "we have heard from thousands of women who have experienced similar discrimination in hospitals. We've heard from doctors, nurses, and healthcare professionals who want to be part of the solution. And we've seen the data. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. We can't continue to ignore these facts. We can't keep pretending that this isn't happening." As she spoke, Dr. Marsh sat beside her, offering a steady presence. Dr. Marsh had been a key ally throughout the process, not only supporting Ashley but also using her own platform to raise awareness. Together they had become a powerful duo, combining Ashley's ability to connect with the public and Dr. Marsh's medical expertise. "Our proposal," Dr. Marsh added, "focuses on several key areas. First, we need to ensure that healthcare providers are properly trained to recognize and address racial biases. This means revising medical school curricula, providing ongoing training for healthcare professionals, and holding hospitals accountable for implementing anti-racist policies." Ashley nodded, picking up where Dr. Marsh left off. "Second, we need to invest in community-based healthcare programs that center black women's voices. Black women need to have access to care from providers who understand their unique needs. This includes increasing the number of black doctors and nurses, especially in obstetrics and gynecology." The subcommittee listened intently as Ashley and Dr. Marsh outlined their plan, but Ashley could feel the skepticism in the room. She had been to enough meetings and hearings to recognize when people were simply going through the motions. Some of the lawmakers nodded, but others were more reserved, their faces unreadable. After their presentation, there were questions, many of them challenging, but none of them dismissive. For the first time, it felt as though the conversation wasn't just about awareness. It was about finding concrete solutions. Ashley answered every question with the same conviction, knowing that this was a moment that could make or break the movement. She wasn't just advocating for herself or her daughter. She was speaking for every Black woman whose pain had been ignored, whose life had been at risk because of a system that failed them. The session ended with a promise from the subcommittee to review the proposal in depth and to draft legislation that would address the disparities in maternal health care. It wasn't a guarantee, but it was progress. And to Ashley, it felt like the first real victory in a long fight. Weeks later, the news came. The subcommittee had voted to approve the first steps of their proposal, and the legislation was moving forward. It was a monumental step, but Ashley knew the real work was still ahead. They had secured funding for anti-bias training in medical schools, committed to increasing funding for community-based healthcare programs, and implemented a nationwide study on the experiences of Black women in maternity care. The legislation, however, was only part of the puzzle. For Ashley, the most important work was still happening at the grassroots level. She continued to meet with women who shared their stories, and she spent time in communities, talking to healthcare professionals and advocating for local reforms. It became clear that true change couldn't come from Washington alone. It had to come from the people who lived the issue every day. Through her work with The Mother's Voice, Ashley also helped create a national network for Black women to share their experiences with healthcare professionals who understood their needs. This network provided a platform for education, empowerment, and support, allowing women to voice their concerns and advocate for better care in their communities. But even as her efforts gained traction, Ashley found herself grappling with the emotional toll of it all. Every day, she read about another woman who had suffered, another family torn apart by the failure of the healthcare system. It was exhausting. It was overwhelming. And sometimes, it felt like the weight of the world was on her shoulders. One night, as she sat in her office reflecting on everything that had been accomplished, Daniel came in and sat beside her. His steady presence, his quiet strength, was something Ashley leaned on more than she realized. "You've done something incredible," Daniel said, his voice soft. "But don't forget to take care of yourself, too." Ashley smiled weakly. "It's hard to stop when there's still so much to be done." Daniel reached for her hand, holding it gently. "You don't have to do it alone. We're all in this together." As the year came to a close, Ashley stood before a crowd at a large conference on maternal health. It was a bittersweet moment for her, knowing how much progress had been made, but also knowing there was still so much work left to do. But she was no longer the quiet journalist, unsure of her place. She was a leader, a mother, and a woman who had found her voice in the fight for justice. "Change isn't easy," she said, looking out over the crowd, "and it doesn't come overnight. But when we stand together, when we refuse to be silenced, that's when real progress happens. We are not just fighting for our own lives. We are fighting for every woman who has ever been told her pain doesn't matter. And together, we will make sure that never happens again." The applause was deafening, and in that moment, Ashley knew that this was only the beginning.